Call the meeting to order. Roll call.
Mayor Calvin.
Here.
Councilmember Christensen.
Here.
Anderson.
Here.
Amman.
Present.
Nelson.
Here.
Plowman.
Here.
Johnson.
Here.
Fagerly.
Here.
8 present, 0 absent.
Stand for the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Are there any proposed additions or deletions to the agenda? With that, I'll entertain a motion for the consent items.
So moved.
Second.
Motion been made and seconded for the consent items. Anything to be removed from the consent? Councilmember Nelson.
Just a correction to the labor relations minutes on who was in attendance. I think it says that all of us were there, and I think there were 2 council members missing.
Correct. Councilmember Johnson and Fagerly were missing out of that.
Mr. Mayor?
Yep.
I will take responsibility for that. I took the minutes, and apparently I didn't do a good job. So that's not staff's fault, that's my fault.
Okay. We'll make that one adjustment. Anything else? All those in favor signify by saying aye.
Aye.
Opposed, same sign. Motion does carry. Consideration of ordinance to rezone from R4 to R3. Mr. Peterson?
Mayor Kelvin, members of the council, the city has received an application from Kuzman Construction to rezone property in the Airplane Estates addition. The property was recently rezoned, or was recently replatted to allow single-family homes. In order to finalize the platting process, the property has to be rezoned from R4 medium density to R3 low density to permit the single-family housing. If the rezoning is approved, I would anticipate some of these homes, these single-family homes, to be constructed yet this year. It's a recommendation of staff that the ordinance be adopted, assigned a number, and published.
Okay, thank you. Anybody here from the public to speak on this issue? Seeing and hearing none, we'll move it to the council table. Council?
Move to approve.
Second.
Motion been made and seconded to approve the ordinance adopted, assigned a number, and publish it. Discussion. Councilmember Nelson.
Just a question on, from the Planning Commission minutes, item number D, stormwater detention plans. It indicates subject to engineering department varying information before the final plat. I just wondered if that had been taken care of, since there have been water issues out there before.
There have been water issues. The issues are on Kuzman-owned properties, and Kuzman is the developer. He is being required by the Public Works Department to provide stormwater controls for this property. The final engineering design is not completed, but it will be before we issue any building permits.
Because the minutes say before the final plat. That's why I was just curious.
The final plat has not been signed. It's been
Okay.
approved, but it's not been signed and filed.
Okay, thank you.
Roll call.
Councilmember Christensen.
Aye.
Anderson.
Aye.
Amman.
Aye.
Nelson.
Aye.
Plowman.
Aye.
Johnson.
Aye.
Fagerly.
Aye.
7 ayes, 0 nays.
The resolution passes. Next, we have a presentation from the Service Cooperative for our insurance review. Mr. Dan Weir.
Yes, thank you. I'm Dan Weir with the Southwest West Central Service Cooperative. The City of Willmar is a stakeholder member in our self-insured joint powers pool, and a long-standing member. So I put together a presentation today to sort of give general background information about some of the features of the pool, and then more specific information about the city's own history and some of the advantages of belonging to the pool. And then after that, I have another presentation of a new program we're rolling out. It's a new transparency technology tool. We're the first employers, public employers in the state to offer this. So that'll be the second presentation. The Minnesota Service Cooperatives, I'm not sure if you're familiar with them, they're regional governmental entities that were basically created by the legislature in the reinventing government era in the 1970s, and Currently, we have about 50 counties, 150 cities, 75 other governmental entities, and about 30,000 employees and family members in our city-county pool. And as I said earlier, you're a stakeholder member in the city-county pool. And then in our school pools, we have about 47,000 employees and another 200-plus school districts, the Willmar school districts in the school pool as well. So that gives you sort of a sense of who we are. We're the largest single purchasing entity. On a statewide basis, we negotiate. We have a common RFP. Blue Cross Blue Shield is the current self-funded administrator, so they pay the claims, but the arrangement is self-insured. So some of the advantages that you benefit from in lower costs are being self-insured. So we created a self-insured mechanism that puts the risk on the service cooperative and not the pool members. So it's a very unusual hybrid kind of arrangement. It's very unique. We've been informed we're the only educational cooperative in the United States that has a pool of this kind, and we're not familiar with any other city or county government pool like this in the United States. We created a VEBA trust in 2002-2003. A VEBA is a unique kind of arrangement that lets employers set aside dollars, their employee dollars only, in preferred savings accounts that are owned by employees. It allows employees to take higher deductibles and or use vacation, sick leave, severance to go into the accounts tax-free. We created our own consumer-directed health plans. We hired actuaries and attorneys and filed high-deductible health plans. We're really the first in the state to do that in 2003, and we started out with $1,000 deductibles. Most recently, we've put in bronze plans. You might be familiar with those on the exchange. So we've offered the same bronze plan design to all governmental entities that are offered through MNsure or the exchange. We also have worksite wellness programs, and the city's been participating in those. Those are wellness activities, a WellCOA, and then we have a wellness incentive. The wellness incentive basically helps reward people that engage and improve in their health. So they have to take online health assessments, participate in certain activities, they have to know their numbers, and then take online courses to earn the full incentive, and that's been a very successful program. The new transparency tool, Clear Costs, is something we're rolling out for the first time, and we have a separate little presentation on that that'll be after this presentation. So what's really unique about the self-funded arrangement, again, a self-funded arrangement reduces the health insurance carrier's cost so that the overall cost is far lower. There's no return on investment for the carrier. There's no risk. The service cooperative, in this case, takes the risk. So when we set your rates have been set this year. The rates include all the expected claims. If there's a refund, run out, all the reserves, they're included in what you pay at 100% of expected claims. There's a liability from 100% to 110% of claims. So if the claims come in at 10% higher, then Blue Cross has the liability. But there's a service cooperative risk or liability of 10%, and that's offset by a rate stabilization reserve. We call it an RSR account. So there's a liability and a reserve, and again, the city has contributed to that reserve over the years. So the way we set our rates, we just went through the advisory committee process. We have a Joint Powers Advisory Committee. The members help make the decisions. Kevin's been a long-standing member of that committee and helped inform the service cooperative of the decisions. But each member in the pool's rates are based on their own use, their own claims use. We also basically have negotiated a fixed cost dollar amount with Blue Cross for administrative costs, and that cost, we've negotiated that Blue Cross gets about a 3% increase in that cost every year over 4 years. So the increases in premiums are not reflected in the increased administrative costs that they charge. We pool high cases between 75 and 300,000. You'll see how we do that. So the pool is able to assume more liability and reduce your costs by doing this. Our specific stop loss this year is $250,000. The pool, or the executive advisory committee, increased that to $300,000 for the coming year. But this renewal was based on $250,000. Each pool member, you at the city, decide the plans that you're going to offer your employees. You decide your contribution and your plans. So our pool is very unique. It allows local decision-making. So you here at the local level can determine what you're going to offer your employees, the benefits, an HSA, the contributions, and the actual plan designs. So, and then we have cookie-cutter statewide plans that are offered to you to choose from every year. So there are a number of different deductible plans, anywhere from $1,200 all the way up to the bronze plan, which is $6,350 for deductible. And that's the lowest cost plan and the highest deductible can be offered. One of the challenges we face going forward are prescription drugs, and this is sort of a kind of a silly thing. You grow up thinking, you know, when you receive health care, your relationship with your doctor is the most important thing, and the doctors, the physicians really run our healthcare system. Yet, you know, as we look at increasing costs, by 2023, prescription drugs will likely cost more than what we pay our doctors. It's just an unusual phenomenon. One of the challenges we have, the reason for that is there's a real rise in specialty drugs. The specialty drugs are these new kinds of drugs that the pharmaceutical companies are creating and manufacturing, and with the Affordable Care Act, we now all have unlimited coverage. So there are a lot of drug companies and medical device makers that are creating things that would have been unaffordable in the past or economically not feasible, and they're rolling them out now because we all have unlimited coverage, and people will receive these treatments and drugs if they're medically necessary. So it's a real cost increase for us. To put it in perspective, these are the average costs for some of the conditions we have. You'll see hepatitis C is probably the one that's getting the most press right now. I think for a 2-month regimen, the costs are $84,000 to $150,000 per person. And hopefully it will cure someone of hepatitis C for some period of time, but it comes at an enormous expense. And there are millions of us in the country, and here very likely in the city and the county and the school, that have hepatitis C that will end up having one of these drugs. And you can see the oncologist wrote to the government about the cost of oncology drugs for cancer as being largely unaffordable. And you can see some of these drugs, you know, they just, the drugs themselves end up being, it can easily be $100,000 or more, which really become unaffordable. And then, you know, people that have these higher deductible plans are going to continue to struggle with managing these costs. When we look at our pool and our cost and your costs, it's kind of astonishing to see the real dollar amounts. So this is a graph that shows the actual cost. So if you have MS, it's a terribly debilitating condition. The average prescription is over $5,000 for that prescription drug. You can see for insulin, anti-analgetics, proton pump inhibitors, the hepatitis agent, antivirals, 9,300, enzyme inhibitors, 6,700. All of these drugs, you know, right now, these are what we're actually paying through the self-insured pool. So these drug costs continue to escalate. It's projected that the drug trend is going to be double-digit into the near future. That's, you know, up to 2023 when we project, or actuaries project, that drugs will actually cost more than our physicians. The good news for you in our pool, the average administrative costs are about 5%. The service cooperative has a fee and Blue Cross charges a fee. That combined fee averages about 5%. It's a little bit higher for smaller groups and lower for a larger group. You'd be considered a little bit larger group. If you were a group that's 50 or less and 100 or less in 2016, the Affordable Care Act lets insurance companies charge 20% administrative costs. And you'll see in the press, you know, administrative costs run 20 to 25%. The self-insured model created by the Service Co-op Joint Powers Agreement, again, that you are participating in, the average administrative costs are 5%. So this offers you the lowest cost possible arrangement to purchase your health care through. One of the other things we do, the pool can take risks. We have about $50 million in claims that come in every year, and several thousand employees and family members. So the pool is basically representing about 50 governmental entities in the region. And so on a regional basis, what we do is we increase our deductible or our stop loss. Just like you would increase your deductible in your car or your house, you increase your deductible, reduce your premiums, right? Most of us have done that over the years. I've had young drivers, and it seems like I have really high deductibles on all my cars. So the pool, instead of buying stop loss at $75,000, which would cost an average of about 20%, the pool purchases stop loss at $250,000. So the overall savings is about 15%. So it's, simple math. You increase your deductible and you reduce the cost. And it seems, pretty straightforward. But of course, there's no free lunch. We have to pay for those high cases. So the way we do that is through our pooling mechanism. The cost of pooling is that red line. It's 7.6%. So we save 15, and our actual claims came in at 7.6%. And then the way we allocate these costs are that pool members that have increases above the red line, we subtract that from their renewal. So we had a pool member with a 33% of their increase was due to these high cases. We took out all the increase, about 7.6%. The city, your city, had no high cases. So there was effectively no cost to you. So at the bottom, you'll see City of Willmar with no high case adjustment saved 15.1% in reduced stop loss charges. Again, in this year, if you were insured on your own or with another carrier, you would have paid another 15% in risk charges to an insurance company. But the way the pool does it, the way we spread the risk, and the way the joint powers arrangement works, the city avoided this 15% additional charge. This is a history of the city's experience the last 5 years. I was talking to Kevin about this earlier. We have your history, back many, many, many years, but people really don't care. The most they can remember is about 5 years. People don't look back and, it's just the time period that I selected that made the most sense. But I think it does represent the long-term arrangement you've had. So it shows each year, 2012, 13, 14, 15, 16. Then the column, the Blue Cross trend. Blue Cross is Minnesota's largest health plan. They insure 50+% of all Minnesotans. And this shows their average trend. The trend is the average increase each year that they passed along to their population of people that they insure. The needed increase, the next column, are what the city's calculated increase. As I said earlier, when we get your claims in at the beginning of the year, Blue Cross looks back and they calculate what we will have to pay out at the midpoint of the next year. So we always want to make sure we're funded properly to pay out the claims. So you'll see in 2012 you calculated to 26.4%. In that year, I'm sure you had a lot of high cases between 75 and 250,000, and that's where we reduced your high cases down to 5%. In 2013, it was 18.8. Your high cases probably were diminished a bit, so that year you were at 12.1%. Then in 2014, so the pool really was helping you the first 2 years. The next year you calculated to a -10 and took a 0, so you were helping the pool that year. Then you calculated to a -1 and you ended up with a -5. Again, in that year the pool had a very good year, and as I recall, I think the executive committee voted to pass along some of the discounts and surpluses that we built up. In the current year, 2016, that you're probably most interested in, the average cost trend or increase was a little less than 9%, 7.8%. The city calculated to a 1.1%, and then again, the pool, you didn't have any high case adjustment, you just had a pooling credit that brought the increase down to 0. So over the last 5 years, the trend has been a little over 7. You've needed or calculated to a little over 7. And in the pool, we were able to bring that down to a little less than 2.5% that you've paid year in and year out. So I think this sort of tells the story of the pool and how it benefits the city and your employees. Again, you're free to offer different plan designs, different deductibles, different contributions. We help you with the purchase and the risk sharing. and reducing the administrative costs, and then it's up to you to sort of work with your employees on what you're offering them. And we have a whole variety of cookie-cutter statewide negotiated plans that you can select from. So again, just sort of in summary, the city is a stakeholder member. We've built up significant rate stabilization reserves, excess reserves. You're a stakeholder in interested party in those reserves. Collectively, through statewide negotiations, we have, work with about 400 to 500 governmental entities and about 75,000 employees and family members. You're represented on the executive committee, have been, I think, since the very beginning. It also, in the pool, allows you, it's very unique, allows you the local flexibility of managing your own plans. So I'm not sure, are there questions on this part?
Yeah, let's take questions on this part before we go to the next part. So any questions from council?
Good.
Everyone's quiet.
Everything looks good, so thank you for the work you do, and thank you for...
Well, I have one more big initiative.
Correct. I understand that.
Oh, okay, thanks.
I just want to thank you for what you've done up to this point, so.
Well, and thank Kevin. Kevin's been an instrumental member of our advisory committee, and there are leaders there tell us what you need, what you want, and we appreciate him coming to the meetings and really giving us the best advice we can get. So
Great.
A lot of our success is attributed to you.
Thank you. You can go on to your next report.
Now, one of the things that in the bidding process, it seems like we're out to bid about every other year. The service cooperatives were created under the Reinventing Government Act and basically our initiatives. And when we were created, the legislature said these pools should go out to bid every 4 years. So the schools go out to bid every 4 years, and the city and county go out every 4 years. So it turns out every 2 years we're out to bid with either the schools or cities and counties. So the last school bid, we went out to bid. We meet with all kinds of vendors and different organizations, and it turned out one of the people that bid on our account was a new technology company created by a physician. And he created a new transparency tool. They're out of Silicon Valley. We're the first public employer that's offering this statewide. And it basically allows people to find out what the actual cost of their services are and allows them to shop for services. So I shop for everything. I shop for gas. I look for BOGOs. I don't know why. I've just always kind of been interested in trying to get the best deal. One of the challenges we have as consumers in healthcare, none of us can shop. If you go to your doctor, you say, how much does this cost? They have no idea. It's a counting in the back room. There are 60 to 80,000 procedure codes that all have a cost associated with it that are created by every provider. And there's 10 to 20,000 diagnostic codes. And so currently, consumers are sort of frozen out of figuring out what anything can cost. So this new initiative is know before you go. Know what your things may cost. And if you go to an emergency room, you're not going to shop. Or if you have the kind of condition that you need immediate care, you're not going to go shop. But for an MRI or a colonoscopy or prescription drug, this new system gives real-time data from the claims that are paid, because we're paying claims on behalf of all your employees and family members. So all this data is mined through this technology tool and provided back to all their employees and their family members on a secure website, and it all shows their past care, and it will show within the Blue Cross network what those costs would be with other providers. It also shows a tool. It's a fair cost provider, so it shows if those charges are 150% or less than Medicare. Medicare is kind of the gold standard for negotiating healthcare costs. So if your provider is charging 150% or less, there's going to be a green circle with a star that will show each of the employees if they're receiving this fair value cost. So I'd like to kind of walk through this. So a couple of questions. Do out-of-network providers cost more than in-network? True or false? What would you think?
True.
True. Yep, that's true. So all in-network providers charge the same amount for the same service.
False.
False. So you're pretty smart. Most people think everybody charges the same amount. It's surprising. A lot of people believe that if you go to one provider, they're going to have the same charge for an appendectomy for everybody, but it's not that way. So we have a little clear cost video. If technology is our friend, you've got a great technology guy here. He's been working around. So we have a little 2-minute video that gives you a general overview of what this program is. Got this one.
Mike likes a smart shopper. Right now, he's scouring the internet to find the best price for his next adventure. His doctor tells him where to go for his care. Mike figures he's got health insurance.
The guy goes in and, has an accident, then he goes back for care. Now he gets the bill. Hold on. Shocked by how much he has to pay.
You're a smart shopper for everything else in your life, aren't you? Why not be a smart shopper with your health
So
care?
why can't he shop for health care?
Just visit the Clear Cost Health site provided by your employer. It's free to use.
So here are the kinds of things on the website. For prescription drugs, it shows potential savings for each prescription.
With a little comparison shopping, you can receive prescription drugs and excellent medical care at a fraction of the price. This time, two things different. Use Clear Cost Health for your in-network healthcare programs like cost, quality, and convenience. It's free, it's completely confidential. You don't need to check your health. Access the online service with your computer and smartphone, or call the 800 number provided by your employer. With the money he saved using Clear Cost Health, he can afford to manage his addiction.
So they're the carrier. Now, we'll finish. Let's go on. So basically, this is, it comes free to the employee. There's no additional charge to the employee when they use this service. We've included the cost in the actual premium in the claims. You can shop and save on health care. They basically will, once you register, you can compare the costs of medical visits, procedures, lab, radiology, prescription drugs. It's HIPAA secure and compliant. And there is a huge variation. I don't know if any of you saw the Department of Health, but it turns out, physician-owned MRI clinics charges are oftentimes 1.5 to 3.5 times what other MRI clinics are. So there's huge variation, and people don't know what these costs are. The information's not available. Blue Cross has all kinds of covenants that they can't share the information, and the providers really have been very reluctant to put price tags on any of their information. I just had to get my car fixed. I got a 17-year-old kid that's driving the car. So, you go into a garage and you get a couple estimates, you know what it's going to cost. Healthcare, nothing like that exists. And this is the first generation transparency tools that provides people with the information in advance. So we got a couple more questions. How much does the price of a new patient visit with a family medicine doc vary within Willmar? So, because ClearCost has all this information, they've got about $400 to $500 million of our claims for the service cooperatives. Then they're leasing Blue Cross of Minnesota information, and then they're leasing the National Blue Cross Association information. That's all over the United States. Oh, sorry. So, how much does an office visit vary? I can get these out here. Okay, so how many say 22 bucks? Nobody. You kind of know this. 46? All right. It's not zero. We wouldn't be showing it. It's actually $254. And the difference is some of the clinics decide to do a few more tests or have a different kind of process. But if you just call up for a family visit, there's huge variation. And no one has any of that information now. You can't find out until this tool is available. So we have another video, but before that, I'll finish the multiple choice. So how much money could the average service member, now this is every employee, spouse, and family member save in the pool. 0, 53, 136, or 382. Of course, it's not 0, it wouldn't be here. How many say 53? 136? It's actually 382. So, I mean, that number amounts to millions of dollars in our pool. Millions, several $1 million that really we can either avoid or be better. You know, I think inherently most of us are pretty good shoppers if we're given the tools and the information. So this really is a new tool that we're rolling out. Once you register and sign on, there'll be savings alerts sent to you. People will be informed if they might have some savings opportunities. They'll encourage you to look at past care. There's a health shopper, and then ClearCost has a shopping team. You can call ClearCost and they'll help shop, and they'll also help you if you want to change. Let's say you had an MRI at a clinic that's $3,000 and you see it online, or with another provider in the Blue Cross network in town for $1,500, they will help negotiate or move that care with your physician to make sure it's covered by Blue Cross and the same provider without switching your doctor. Because the doctors generally don't care. They just, you know, make the referral to whoever they want to. So basically, we all in our system, your employees have the freedom to choose wherever they want to go. And the system is an open system, and you can go for second opinions. So this freedom of choice really works to our advantage in terms of shopping. Now we also, so the ClearCost team is available Monday through Friday, 8 to 7, and you can contact them by email. Now we have a second video that actually shows the system, and I'll try and talk through it, although the narration is much better than I am. So basically, this is the website. It's a secure portal. It's the Southwest West Central portal, so all employees would go to that to register, sign up and register. So you basically click on Register Now, and I think it's running, isn't it? Yeah, so they have a lot more words than I have. So this is basically the secure portal. It's HIPAA compliant. It's very secure, and it basically hosts all the claims information and health plan data for all the employees. So each employee can use their own personal email address. The employer never sees any of the information. The pool doesn't. They can sign up and register. So the registration is simple and easy. Just like most websites, you have to set up your own username and password. Your username will be the email address that you decide to use. So you plug in your last name, your date of birth, the last 4 digits of your Social Security number, or your Blue Cross Blue Shield ID, either or, whichever one you'd like. Then you continue, so you include either your personal or your work email address. Most people probably use a personal. They'll set up their own user or password and then confirm the password. Then, like most websites, you set up your own security question and answer. You put in your phone number that you'd like to be contacted, home or cell. Then you have to agree to terms and conditions. We're asking how you found out about the website. So you're basically have set up your username and password. So then you can go back to the site and log in. So I think that'll be the next slide. So I think you go sign in now in the upper right-hand corner. And this is the page that you'll, or wait, now they're signing in, sorry. First you sign in, it brings up this, you put in your username and password, and this is the home page. So it shows basically your health plan that you're covered by in the upper, under the red box. It shows your location, what's your pharmacy copay, what's your deductible, what plan you're on, and it keeps track of where you're at in your deductible during the year, where you're at in your maximum out of pocket. So it gives you in real time information about how your claims are accumulating in your health plan. There's a fair score. It shows your score compared to the service cooperative average in terms of fair price providers. How many are, on average you're receiving a percentage of your care compared to the fair price of the average. And this is the 150% or less of the Medicare reimbursement. So people will get a sense of their provider's charges. Then you can also do a search. So in this search you can type in, I think this one might be colonoscopy. This is a colonoscopy with a biopsy. So it brings up the data. This isn't really a good screen, but it shows how close you are, what the average cost is, your cost, and the plan's cost, and then also if it's a fair cost provider. And then the far right column is health grades. That's the largest organization that evaluates doctors and hospitals in the country. So all that data is baked into the website. You can click on any of these and it will give you more information about specific providers that will provide that actual procedure. And then you can also click on the clinic and it'll bring up Google Maps. It'll show you where it's at and how to get there, their phone number and their hours. You can do a radius search, so if you want to search 25 miles or 100 miles, if you want to go to the University of Minnesota or Mayo Clinic, all you have to do is you can scale that little circle and make it larger. This is a search for a drug, Humalog, and you put in the prescription, the strength, and then do a search. And then this search will show, I think it's Walgreens, is it Thrifty White, and Walmart. So it shows their cost, and it shows the cost of the drug and your cost. And then you can click on any of those, and it'll give you more information. Now you can also go on past care. Now past care shows all of the services you've received or family members received in the last 12 months, medical office, procedure, lab, radiology, and you can click on those, and the very right column shows the savings. I think that's $112 or something for that prescription. And these are all providers within the Blue Cross network that have been certified, that pay claims, and so they're all allowed, you know, you can receive services and drugs from all these providers. And then it does show the scores for recently used medical providers that you've searched to see if they're falling within the fair price provider category. So again, this is a new technology tool. You know, I think we're about at the end of this. So technology has really reduced the costs of almost everything, you know, every manufacturing process. But for healthcare, you know, the average doc costs about $50,000 to take their paper files and, you know, turn them into electronic files, which was a huge cost that we all ended up paying. Now the hospitals all have to have interactive files. Under the ACA, all the physicians in hospitals have to communicate with everyone over everyone's care. So now the patient is more centered in terms of receiving services, and I think this really is the first technology tool of its kind that will provide information and data to people. As I said, you know, knowing before you go is the key. Our average deductible in the pool, over 50% of our people are on high deductible health plans that average over $2,500 per person, $5,000 per family. So that's a significant dollar amount that all of our people are exposed to. So for the first time, this is a real technology tool people can, your employees and their family members can rely on to help them figure out how they can shop and get the best deal and not give up on quality. You know, the idea here is not, you know, to find the least quality providers. It's just to have a sense of what the costs are and allow people to shop and make different choices.
Okay. Thank you. Council, any questions for Dan? Councilmember Anderson?
Thank you, Mr. Mayor. That is really, really interesting. Did you say that rolls out the first of the year? Or?
Yeah. Well, it's actually rolled out right now, so it became effective September 1st, but we've incorporated into our wellness incentive program. So to earn the wellness incentive, your employees have to go on ClearCost, set up a username and password, and register, and then we hope to do a search. So our real rollout, we hope, we've had thousands of people receive these incentives. You've had, I think, a significant percentage of your employees receive these incentives. So it's active and available now, but I think we hope to catch most people in this incentive process in October and November.
My reaction is this is really, really interesting, and And I think it's got the real potential to save everybody money. I mean, it's going to save the insurers money, it's going to save the employees money, which is the most important thing. So I'm really excited to see how this is going to pan out, you know, over a period of time. But it really looks encouraging to me.
Thank you.
Councilmember Ahman.
Well, thank you, Dan. I was just curious, do you think we can get some of that information and put it in our Dropbox so we can digest the first and the second part a little clearer and we have more time to look at it? That would be very helpful. It's a lot to digest in a short time, and I appreciate how quickly you moved through it, but you did a really good job on putting it together, and I loved your slide presentation. You know, how does this change things legislatively? Is there anything that's going to be affected by the changes that you're proposing for more openness and cost sharing or involvement in maintaining and keeping the costs down for insurance?
You know, it's a great question. This is a technology application that sort of bypasses all the traditional rules, because they're basically asking the employee for their permission to get their own information about their claims. And in the past, even though Blue Cross is a great provider and they're sort of on the edge, they've been reluctant or don't have the technology systems that give that information real time to people. So there are the authorization comes from the employee to look at their own information. If an employee doesn't activate it, the data is just sitting there, so nothing happens. So it doesn't need any regulatory changes. It basically needs people to use it, to learn about and use it. That's our biggest hope. Now, we would hope you could take this PowerPoint and also the 2 videos and post it on your employer intra website so people could go through it and look at it. When you hear the video, it's much better than me going through it. So believe me, I think people that will listen to it will get a lot more out of it. But we're hoping that you can post this for your employees and encourage them to use it, because they have the biggest stake. And as you said earlier, they're the people that can really save the money. And of course, we do downstream. If people avoid a $1,000 additional cost, the max out of pocket, or the insurance is used at a lower level. But the real savings are to the employee, and then engaging the employee, because the one thing all employers are trying to find out is how we can engage our employees in understanding that this health insurance is a wonderful benefit, but the costs are driven by their use. And so having a good conversation and some tools and information for employees so they can help understand that. And I believe your employees will be the best at doing this. We can rely on good common sense to figure out, hey, if the MRI costs $2,400 and I can get it for $1,200 and it's a knee MRI and I schedule it out for a week, why not change it? I mean, there's no reason not to take, advantage of that efficiency. So it doesn't need any regulatory change. It just needs people to use it.
Is there, you talk about the competitiveness and the price shopping, which is, like you said, very unusual. Usually I was not aware of the differences and substantial differences in different services that you pay for at different clinics or hospitals. Just bringing that to my light was really great. I like to support our local hospitals as much as possible, and that's one question. Do you think this is going to lead to a different competitive nature in the future of local hospitals or clinics?
Well, I think healthcare, as we know, is changing rapidly. There was a big article in the paper this morning about online care, the ability to have online care, or a lot of hospitals are setting up clinics in their grocery stores. They're trying to find people at convenient locations. Why would you go in for an office call? It's $140 if you could get the same service at a grocery store for $75. And there are all these low-bearing fruit, kinds of conditions, renewal for a prescription, acne medication, urinary tract infection. There are lots of things that can be treated by physician assistants or, in an online way that will change how we receive health care. The big items like heart transplants, those kinds of things, are just going to always cost a lot, and there's probably some efficiencies that we can look at. But I think as the healthcare system changes, as specialty drugs become more and more expensive, as we look at our own drugs and brand name drugs, these tools will help, I think, reshape consumerism. But I think once the consumer gets involved, once these technology tools sort of play out in new generations, I think we have a chance of transforming healthcare. And the hospitals, They're our best and brightest going to medicine, and they'll adapt, they'll change. You know, I'm very confident that they're up to the task, and I think they have huge systems that they have an obligation to deliver care, and they're doing it in the best way they can. It's just, I think, technology and information hasn't really helped transform healthcare the way it's going to. And I think this is the first tool of first generation that helps the consumer sort of get more involved.
Thank you very much.
And I'd like to also thank you for coming out and thank you for the information that you're sharing with our employees. At the end of the day, it's all about our employees and making life better for them. So thank you for the work that you do.
Well, thank you. And I'd like to thank you as well, because Kevin has just been an instrumental person on our executive advisory committee, and really, we're driven by you. You know, we want, it's a joint power, self-funded arrangement, so whatever needs you have, we try and respond. So we certainly appreciate your membership, and as I said, you're a stakeholder member in our pool, and we certainly appreciate your participation.
Thank you.
Thanks.
Next on the agenda is the open forum. Now, Dan, you're certainly welcome to sit and watch the rest of our meeting, but if you'd like to leave, we do understand you probably have better things to do, but that's up to you. It's your choice. So, first we have Lauren Schultz. Mr. Schultz? You can just slide that
Lauren
laptop
Schultz, 901 Irene Avenue, Southeast.
Thank you.
I see in the paper you're interested in doing something with the water issue. Is that for all of you or just the mayor?
We generally don't respond, Lauren, so just go ahead with your presentation. I believe it's a commitment of the entire council, from what I've heard.
Well, here's the plan I gave the Army Corps of Engineers about 6 years ago, and he said it would work. But we have a lot of problem with transparency someplace. Governor says he owns 16.5 feet on each side of the ditch, and we ain't using it. At the stagnant water level at the bottom of the ditch, there's nothing grows below it. But if you go up a foot, you get into the cattail zone. And if we went completely flat 16.5 feet and added another 16.5 feet, we'd have 33. That'd be 100% more water per mile in our ditch system. We can't contain it. Last year when we got the rain, your fire trucks went out to pump the ball field, backed the water all the way up to Eagle Lake where I was working. That was after 4 days running at the same elevation. That's how full we are. It was that far from running in your sanitary sewer and filling it. That's how overtaxed it all is. We have to make room for it. You can't dump 20,000 acres of water in an industrial park and survive. Won't work. So we got to make some changes. 50-foot grass isn't going to make it. It helps. We have another 50 feet to work on. So you have to leave one side of the ditch alone so you can maintain it. That's a must, because you can't have this extra room out in the middle, the ditch out in the middle. But I got a drawing here I'd like to show it to you. I give this to the Army Corps of Engineers Regulatory Commission before we did the sewer project. And we went way overboard on the sewer project. We owe a lot of money. Let's do a better job on this next project we got going right now.
Thank you, Lauren. Appreciate it.
Thank you.
Next we have Sue Quist. Ms. Quist?
My name is Sue Quist. I live at 1451 Hanson Drive, Southwest, Willmar. I'm ready, Kevin. Jessica Roloff, representing the League of Women Voters, accused Councilman Christensen of saying that he referred to his constituents as a special interest group. He wouldn't take direction from his constituents who signed the petition. This is a false statement. I encourage all of you and all citizens to view the end of Part 1's August 17th council meeting and the beginning of the September 8th council meeting for yourselves. To summarize what Councilman Christensen said is he can't trust the people that were the same members of the Moving Willmar Forward group, campaigned for Kelvin and recalled Ron, and wouldn't take their advice. He did not include his constituents that signed the petition, and he did not say that he wouldn't listen to anybody despite their bullying. However, he shared why he wouldn't take their direction. Councilman Christensen said that he didn't trust them as they lacked wisdom, which was evidenced by their poor, very poor decision-making. He refers to the toxic environment from the leaders of these groups who spewed hatred in his ward, how they tried to destroy him and divided our council and city. We, the majority of Ward 2 citizens, elected Ron Christensen multiple times as he has proven to be a leader representing and standing up for our ward and our city, even through all these personal attacks. To support Jessica Roll's opinion, she quotes the U.S. Constitution, which states all citizens have equal protection. I agree full-heartedly with the rule of law, which is why I question the sincerity of her comment with a fact. On June 24th, 2015, the Recall Ron marketing director, who is a member of the League of Women Voters and one of its former officers, Susanna Kempsick, solicited signatures from elderly people at the nursing home. Woman was on her deathbed. She expired about 7 weeks after she had signed. Kempsick also solicited signatures from vulnerable adults from a group home, one of which cried her head off when her mother explained the document that she signed hurt Ron. In response to Lynn Ron's letter to the editor, who questions my credibility, my views are based on facts derived from documents such as a copy of the petition, which I requested in writing from the city and paid for. My opinion is also based on reliable testimony, such as from friends of the inflicted family members that shared their heartache and righteous anger. According to the League of Women Voters mission statement and core values, we believe in respect for individuals and the power to collectively decision-making for the common good. Where was the respect or common good in these unscrupulous antics? Inappropriate solicitation and trying to recall a council person based on misrepresentation and lies.
Thank you. Next, we have the Community Development Report of September 17th. Councilmember Fagerly.
Thank you, Mr. Mayor. Item 1, we called the meeting to order at 4:45 on September 17th. Item 2, public comment. No one was there to speak to us. Item 3, this is a motion. It was an order for removal of a house at 944 Olaf Avenue Northwest. Staff provided an update on the removal process for the home at 944 Olaf Avenue Northwest. The owners have not complied with the extension for removal as previously offered by staff and the council. A formal order is the next step in the process to eliminate the hazardous building. A formal order has been drafted by the city attorney, Mr. Scott. The order provides for a 20-day period for the owners to make the necessary repairs to the house or remove it. The order includes the direction for the city attorney to process or proceed with this matter according to law. Following discussion, there was a motion made and seconded and passed that the order for removal be approved and served on the property owners. So now I'll introduce that motion.
Second.
Motion been made and seconded to order the removal of a property at 944 Olaf Avenue. Discussion. Those in favor of the motion signify by saying aye.
Aye.
Those opposed, same sign. The motion does carry.
Item 4, removal update on 810 Campbell Avenue Northwest. This is for information only. Staff offered a status report on the efforts to remove the hazardous building at 810 Campbell Avenue Northwest. Following contact by the city attorney, the property owner did apply for a demolition permit. It is expected that the structure will be removed in the fall of 2015. Staff will monitor the demolition permit for the compliance. Item 5, industrial park update. The committee discussed progress at the industrial park expansion. It was noted that the project started out very well in the spring, and most of the infrastructure work was completed on schedule. The contractor recently contacted the city regarding a concern about soil moisture within the road right-of-way. The recommendation was to increase the amount of granular material, thereby raising project costs. City engineering staff countered by saying that the soils were suitable if the contractor would work them and allow them to dry. Contractor is currently on site working on the streets to accommodate the contractor on the soil issue. Staff has tentatively agreed to a deadline extensions to June 2016. Item 6, the Willmar Y. Mr. Peterson did travel to Washington, D.C., and since he was there and I wasn't, I will let Mr. Peterson talk about that trip.
Mr. Peterson, would you like to give us a report on that, please?
Mayor Kelvin, members of the council, had the opportunity a week ago to travel to Washington, D.C. to meet with our congressional delegation to discuss very directly their support for the Willmar Y project and the Tiger grant that has been applied for. The council might recall that a $15 million Tiger grant has been applied for, and it is the final piece remaining in getting that project constructed. We believe we were very successful dealing with our congressional delegation. We'd always had good support from Congressman Peterson's office. Senator Klobuchar's office indicated they were going to make a phone call to Secretary Fox the next day, and we were very delighted in that we apparently convinced Senator Franken to do likewise. He had refrained from taking a proactive position on our behalf. He didn't want to prioritize any project in Minnesota ahead of any others, but once we got him to understand that the governor was making this his #1 project, and the Commissioner of Transportation likewise was making this their #1 rail project, Senator Franken did agree to call Secretary Fox at the Department of Transportation and support our project. So we're cautiously optimistic, and we'll hear by October 15th if we are chosen for funding.
Thank you. It was yourself, County Engineer Odens, and County Commissioner Butterfield that went?
That's correct. Okay. And then there was 3 representatives from BNSF that we met up with in Washington, their Washington liaison, and then 2 people out of their Dallas-Fort Worth office that deal with public-private partnerships.
All right. Is there anything else that we can do, or it's a waiting game?
It's a waiting game now. I delivered letters from the mayor to each of the members of the congressional delegation, and we have a very strong application. What prevented it from being funded the year before, they said, was really a lack of vocal political support from our Washington delegation, and we made sure that didn't happen this year. So we'll see.
All right. Thank you.
Thank you.
I don't know if there's any questions to...
Any questions on the Y project or the visit to Washington? Okay, go ahead.
All right. Item 7 was old business. I did ask one question. Did you ever find out on the Kindle Hope site what's going on there? I see there's silk berm there and a contractor's trailer and porta potty.
I have not. The building official and my schedules have not meshed very well since the end of last week, so I will attempt to do that, and then I will notify you by email.
All right, that would be great. If there's no questions, I move to file the minutes.
Second.
Motion been made and seconded to file the minutes. Discussion. Those in favor of the motion signify by saying aye.
Aye.
Those opposed, same sign. The motion does carry. Kevin, consideration of certifying special assessments for Habitat for Humanity.
Mr. Mayor, members of the council, last week after a hearing, you sold property for $1 to Habitat for Humanity contingent upon them picking up all the special assessments for that lot. You have before you a resolution showing those dollar amounts. Basically, it's $9,191.62 for a project of streets in 2010, and we asked that you certify that for collection over 10 years at the 4.25%, the interest rate of that project year. And then there's special assessments for the street lighting project of $430.66 at the interest rate for that year at 4.20. It is staff's recommendation we adopt a resolution for collection of those over the next 10 years.
Move to approve.
Second.
Motion made and seconded to approve staff's recommendations. Discussion. Roll call. I'm sorry. Go ahead, roll call.
Councilmember Anderson.
Aye.
Amon.
Aye.
Nelson.
Aye.
Plowman.
Aye.
Johnson.
Aye.
Fagerly.
Aye.
Christensen.
Aye.
7 ayes, 0 nays.
Resolution passes. Next is consideration of final plat, Cambridge 4th Edition. Mr. Peterson.
Mayor Kelvin, members of the council, first off, Councilmember Nelson, I aired the question you asked me before does apply to this plat. I was thinking of another plat that Kuzmins had recently filed just north of that. So the Cambridge 4th Edition final plat is a replat of a portion of Terraplane Estates, and it does provide for single-family development. It's a planned unit development on a private street with private utilities, and it will be governed by private covenants and declarations. The Planning Commission did approve the final plat with several conditions regarding the filing of covenants and declarations, private utility connections, stormwater detention, and the rezoning that the council considered this evening. And all of those conditions will need to be met before the final plat is executed and filed, and that does include the final stormwater plans that will go through the Public Works Office. It's a recommendation of staff that the council approve the final plat with those same conditions.
Move to approve.
Second.
Motion made and seconded to approve the Cambridge 4th Edition final plat. Discussion. Those in favor of the motion signify by saying aye.
Aye.
Those opposed, same sign. The motion does carry. Next is the consideration of preliminary final plat for Eastgate Edition on 25th Street Southeast. Mr. Peterson.
Eastgate 2nd Edition is located at the far north end of 25th Street Southeast. It would be north of the Cenex station on East Highway 12 and directly adjacent to the railroad tracks. This is a replat of a parcel of land owned by Chips Holding. They have a very large parcel and they developed the front portion of it. The only way that they could develop the rear portion of that lot was to develop it as a commercial planned unit development and to provide a private street into it. They have done that. The plat has been prepared with all the covenants and articles of declaration. There was no additional stormwater retention required for the plat, but a future project may drive some independent stormwater improvements to be made on that site. The Planning Commission approved the final plat with conditions to be met prior to final plat signatures, such as, again, the declarations and covenants that go with a planned unit development, one additional utility easement that needs to be added to the plat, and signing the street for no parking. It's a recommendation of staff that the council approve the plat with those same conditions.
So moved.
Second.
Motion made and seconded to consider the preliminary final plat for Eastgate Edition on 25th Street Southeast. Discussion. Those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Next, we have the consideration of an introduction of an ordinance to rezone governmental institutional to agricultural, Willmar poultry. Mr. Peterson.
Yes, this is action that follows the council's agreement to sell the property to Willmar Poultry at the last council meeting. The property is currently zoned government institutional, and ag uses are not a permitted use or a stated use at all in that zone. The ordinance is being introduced simply to legitimize the zoning of the site to facilitate the development for Willmar Poultry. And it's a recommendation of staff that the ordinance be introduced for a public hearing at the October 5th, 2015 meeting.
Move to approve.
Second.
Motion been made and seconded to approve the introduction of an ordinance to rezone from government institutional to agricultural on October 5th. Discussion. Those in favor of the motion signify by saying aye.
Aye.
Those opposed, same sign. The motion does carry. Kevin, the consideration of proposed transfer of the charter cable franchise.
Mr. Mayor, members of the council, you were informed a while back that the city was in receipt of a resolution and an application from Charter Communications to transfer control to a new group of shareholders that consequently will be called New Charter. The city has a 15-year franchise agreement with Charter, and our cable attorney had quite a few concerns with their proposed resolution, which he stopped the process and worked on that on our behalf. And you have before you a new resolution that he is recommending to pass. It does acknowledge the consent of the transaction to New Charter. It does hold our franchise in full force and all those terms that are in there, albeit that's only for another year till November something of 2016. But it is staff's recommendation upon the approval of our cable attorney, Moss and Barnett, that we do approve the resolution that they asked transferring the cable franchise currently held by Charter Communications to New Charter.
Move to approve.
Second.
Motion made and seconded to approve the proposed, the transfer of the Charter cable franchise agreement. Discussion. Those in favor of the motion signify by...
Resolution, sir.
Roll call?
Councilmember Amon.
Aye.
And I thought it was going to be a roll call, but I didn't
Nelson.
have my notes.
Aye.
Plowman.
Aye.
Johnson.
Aye.
Fagerly.
Aye.
Christensen.
Aye.
Anderson.
Aye.
7 ayes, 0 nays.
Resolution passes. Next up is the announcement of committee meeting dates. Councilmember Amon.
Tomorrow, 4:45, conference room 1, labor.
Finance.
Next Monday, September 28th, 4:45, City Hall.
Public Works, Public Safety.
September 29, Tuesday, City Hall.
And Community Development.
No meeting.
Okay. There we have our public meetings. In front of you, you have a proposal from Big River Group, LLC, for a council retreat. You'll see the date of September 15th. That's the date that or December of 2015. That's when we received it. But the proposed date is October 16th. Kevin had, at the last meeting, I had asked if you had any conflict dates to get those to Kevin, and we put all of those dates together, and the 16th was an open date. And so we're looking at a retreat on October 16th at 1:30. The location is yet to be determined based on the outcome of the council agreeing to the retreat. And they will pick the location, but the date will be October 16th, 1:30, which is a Friday afternoon, scheduled to go approximately 4 to 4.5 hours. So if there's any discussion on that, we can take that now. Otherwise, we'll move forward with getting this together. One of the things you'll notice is that in-person interviews will be done with all council members and also the department directors and other key staff. And from that, we'll determine as to whether or not we'll have those key staff members at the retreat or not, but we'll give you an update either in the weekly notes or at the next council meeting as to those that we recommend attending. So that's for information as well. So anything else for the good of the order?
I'll move to adjourn.
Second.
Second.
Motion has been made and seconded to adjourn. We are adjourned.